Hello, I am Dr. Alexandre Amato, vascular surgeon at the Amato Institute, and today I will talk about the association of two very common diseases, which are varicose veins and lipedema. Varicose veins occur when I am talking about women. In around 45 to 50% of women will develop varicose veins during their lifetime. Lipedema, 11% of women are affected. So you can see that both are very prevalent, very common diseases. Since I'm talking about lipedema, which is a disease restricted to women, the frequency of varicose veins in men doesn't matter in this video. But for women then, 45% to 50% will have varicose veins and 11% of women have lipedema.
E 11% das mulheres têm lipedema.
Now, when we look at patients with lipedema, around 39% of them will have varicose veins. And when I look at patients with lipedema, 52 to 53% of these patients will have the notorious spider veins. Those very thin varicose veins, those dilated spider veins, the telangiectasias. So, the population with lipedema has a much higher frequency of varicose veins and spider veins. That's why the discussion of this association is very important. We need to talk about the diagnosis and treatment and how it should be done. Why? Because the complaints, signs, and symptoms of lipedema and varicose veins can be confusing. So both lipedema and varicose veins will cause swelling, pain, heaviness, fatigue, that feeling of leg edema, sometimes leg fatigue. All these complaints then can occur in both conditions. That's why it's very important for us to identify which symptom is coming from which disease. Because if we treat the dormant disease, the one not causing symptoms, often we end up worsening these symptoms after treatment. But not everything is bad news. What I can also share as good news is that some treatments for venous disease and varicose veins also help with lipedema. So often we aim at one target, miss that target, and end up treating another one by accident. And there is some improvement. Look, in the treatment of varicose veins, elastic compression, the use of compression stockings is also beneficial for lipedema. Obviously not in a critical inflammatory phase, but it will help. It will help prevent the disease from progressing, reduce the feeling of swelling. So sometimes we're treating one thing and end up helping another. As long as it benefits the patient, that's great. Additionally, avoid obesity. Avoiding obesity is good for both lipedema and varicose veins. Obesity is very common and occurs in both conditions. Obesity ends up worsening the progression of both lipedema and varicose veins. The medication treatment for varicose veins includes some drugs that cause a slight improvement, but they also help with lipedema. So you see, sometimes the patient has both conditions. Sometimes they have one symptomatic condition and the other dormant without causing symptoms. But as long as we get the treatment right, sometimes even if the diagnosis is wrong but the treatment is right, it will bring a benefit to the patient. Now let's talk about what to treat first. Let's suppose I have an accurate and well done diagnosis of both varicose veins and lipedema. Which one do we treat first? There are several aspects that need to be considered. The surgical treatment for varicose veins is much easier to be approved by insurance. It's a more straightforward procedure, let's say. We know that we'll request the procedure, it will be performed. And in a short time, the patient is already back to activities, speaking of varicose vein surgery. But sometimes the complaints aren't coming from the varicose veins, they're coming from lipedema. And this is a big problem because when we perform varicose vein surgery on a patient with lipedema and in a critical inflammatory phase of lipedema, often there's a dramatic worsening of these symptoms. So what do we see? There's an interesting study in the literature that shows in this association when they perform varicose vein surgery in the presence of lipedema. In more than half the cases, there's no improvement in swelling. There was a mistake about what was the main cause of this patient's swelling. Now, regarding varicogenic symptoms, even with lipedema, around 20% of patients might not see an improvement in these symptoms either. So the ideal is at least to be doing clinical treatment for lipedema to get out of this inflammatory phase, and then you can treat the varicose veins with very good success, with a very high probability of success. Now, another interesting aspect, lipedema always requires clinical treatment. No patient with lipedema should avoid or skip clinical treatment. Clinical treatment is essential, but the gold standard is surgical treatment, which is liposuction. And an interesting aspect of liposuction is that during the procedure, varicose veins can also be removed. So you end up treating lipedema surgically, and there is a significant improvement in varicose veins as well. But there's a greater difficulty in getting insurance approval or in getting approval for this to be done with insurance coverage. So it's very important to discuss with your doctor which condition to treat first. Although, in my view, lipedema always has to start first, at least with clinical treatment. That's indisputable. It's not worth doing cosmetic varicose vein treatments, injections, laser, whatever it is. If the lipedema isn't clinically controlled, you'll have issues with discoloration, pain, swelling, and a more uncomfortable post-procedure. The big problem is when you have one disease and the other isn't diagnosed. So that's why you need to talk a lot with your doctor. You need to understand the risks and benefits of each treatment. And what I always tell everyone, ask all your questions before the procedure. Don't leave them for later. Don't keep any doubts for later. If you have any doubts, want a second opinion, get a second opinion before the procedure. Because if you do a procedure and something goes wrong, later you won't want a second opinion, later you'll want an expert, and that's a different thing. Treat both diseases. Talk to a specialist in both diseases, which is the vascular surgeon. If you like our videos, click below, subscribe to our channel, click that little bell too, because YouTube isn't sending videos to those who don't click the bell. And see you next time.